Hey guys, Ralph Havens here, physical therapist at Beyond Limits Physical Therapy in Bellingham in Fairhaven, Washington. And I'm very happy to have my friend Rachel Harmon. She works a couple of blocks away. She's a naturopathic physician, a doctor, and an athlete. And today I want to pick her brain about perimenopause and not just the runners and the athletes, but active people in general. And you gave me a great outline. So I'm going to kind of just start to just ask you questions, and I just want to know what's going on. Can you introduce yourself a little bit about like your background? I know you're an athlete and you've been through a lot of stuff and you're a doctor. Yeah, thank you for being here.
Oh, well, thank you so much for having me. I'm very excited to be here. I am a naturopathic physician and I'm also trained in traditional Chinese medicine. I went to Bastyr University, and throughout my youth and that time at school, I was really into outdoor sports. So ski mountaineering, mountain biking, played all the sports in high school, played on the boys basketball team. So being able to have a healthy, active body is something that I really value. And I wish that for everyone. And we're lucky to be in Bellingham, where we work with people who like having healthy, active bodies as well. And so talking about hormones and menopause and perimenopause is a way to keep those active bodies happy and healthy into the later years of life.
That's awesome. Yeah, and I you know, hormones is like with performance and that sort of thing. We have the performance enhancing drugs, and so we all know how testosterone can affect things in EPO and human growth hormone. And there's athletes that cheat and use those kind of things. And hormones, we've all experienced the going through teenage years and what that's like with the hormones. And
Sure.
and then there's this whole thing of as women get into the 40s and 50s, this idea of not an idea, but menopause. And then people call this perimenopause when it's building up to this moment when the period stops, and hormones can really shift a lot. And we have testosterone and progesterone and estrogen, and you and I have a different. Well, you tell us about your overall idea around this, like as women and athletes, female athletes, especially going through the 40s and 50s, there could be a wide range of symptoms that may not be thought of as like totally because of a hormonal shift, a physical thing, and it can range from all sorts of non-physical things like anxieties and stresses and existential crisis, like midlife crisis ideas, and
Sure.
what am I going to do with my life kind of thing. And
Sure.
there's all sorts of changes, and then wanting to keep active. But tell us about your philosophy on that time of life, especially for women and
Yeah, sure. So I think it's important to understand sort of the definition of what we're talking about. First of all, not everyone knows that menopause is actually one point in time. So menopause marks 1 year without a period. Whereas there's perimenopause, which not a lot of people talk about, which is the 10 to sometimes 20 years prior to that moment. And that's where you can see a steady decline of hormones or sometimes an erratic rise and fall of hormones, depending on the person. And what really dictates, in my experience, sort of the ease of that transition is how healthy someone's nervous system and adrenals are going into that. It's not just about the hormones themselves, because when your ovaries are retiring or sort of going offline, your adrenals are sort of your backup generator, and they're going to produce your stress hormones and a little bit of sex hormones to get you through that next chapter of life. So, what I
mm,
really like to emphasize as we're approaching the menopausal transition in the perimenopausal years, usually starting around age 35, is making sure that we have healthy stress coping mechanisms, a healthy adrenal response, and we know how to sort of prepare for that transition. Because if it just hits you like a Mack truck, that's a little too late to make those big changes.
yeah, and so the adrenals, aren't most people's adrenals like having a problem these days? Like,
I
what do
would
you?
say it's more common than not, unless you live on an island without access to the news. And the thing with exercise and athletes in particular is it can be a healthy coping mechanism. But if you're, doing a lot of distance races and endurance sports, we need to talk about, how much is that benefiting you versus how much could it potentially be harming your adrenals. So we might shift more towards strength training, weight training, and needing longer recovery times rather than just hitting, 50-mile, 100-mile races every single week.
Yeah, because I know for the male distance runners, the ones that train lots of miles really hard from teenage years and on, their careers a lot of times end early because their testosterone drops, and they just totally flatten out.
It's a big stressor on the body. I mean, running, especially endurance running, and I'm more of a cyclist, so I know cycling to that extent, it's a catabolic state. So it's breaking down tissues, it's glycogen demanding, so your stores are being depleted, and it's very, cortisol demanding as well. So the cortisol being the main hormone that everyone talks about, it's very advantageous. It's your morning cup of coffee, it's your get up and go. But if you're just pushing it super hard, especially maybe training fasted, which has gotten a little trendy in these more recent years, that can really put more strain on the adrenals. And then when they have to step up to the plate after the ovaries retire, they're not going to be able to perform the way you want them to. And that's why
Yeah.
I hear all the time from women, they're like, oh no, I've always run 5 miles every day. I've always worked 12-hour days. I've always been, volunteering for every PTO meeting. I've always taken care of my aging parents, but now I can't do it anymore. And it's like, well, your body's a little different than it used to be. And that's okay. And we just need to find modifications for you to be able to do that.
So I'm going to ask you more about like how to get those adrenals and that whole system optimized for this transition. But it does seem like a lot of people have been living in a state of not so good for their adrenals up to this, and then they're hit with this thing and they keep trying to push through. Um, what do I, what, how would, what are some of the symptoms of like, they can be, what are, like, say a woman and 40, maybe close to 50, that sort of thing. What kind of symptoms would show you that, oh, there's something going on with adrenals or something going on that might be problematic as somebody goes through this time in life? What are some of the symptoms?
So some of the first things that you'll notice, and menopause in general, there's over 100 symptoms of menopause. But if you go to a doctor, you're lucky to even get asked if you have hot flashes or night sweats. Those are the two symptoms that people know to ask for. But there's things as strange and peculiar as ear itching that can pop up in menopause. Brain fog is a big one. 5 to 10 pounds of weight gain is a big one. Irritability, changes in your performance. You'll notice as your progesterone declines first, which is the first hormone to decline in the perimenopausal shift. And that's really because ovulation isn't happening as often. And progesterone is really important for ovulation and retaining a baby during pregnancy. As that starts to decline, the first thing you'll notice is poor sleep and nervous system irregularities. So you can't get that good rest and recovery. The same 7-hour period in bed is not as restful as it used to be. You might be waking up multiple times per night. You might feel like you have heart palpitations, or you just feel nervous or anxious or jittery at night and you can't get that good sleep. As then estrogen declines after that, you'll notice more physical symptoms typically, especially in your athletes. So because you don't have that yin, that rich lubrication in the joints and the tendons and the muscles, you're more prone to stress fractures, joint injuries, arthritis, and tendinopathies in particular. You'll see that a lot with people. So it's really trying to get ahead of those things before they present as physical symptoms in an athlete.
So progesterone goes down on a kind of a predictable kind of like
Typically.
a downward curve like this, but estrogen goes down. It can also just go up and down in very strange ways. Not strange, but like
It's
it doesn't
strange.
it doesn't
Yeah,
just go
it's strange.
down
Right.
with a predictable like, oh, this is the estrogen
Right.
response.
Right.
It can go up and
Right.
down, right? What
Right.
happens if somebody's they're going up and they're going down?
Right. Yeah. So sometimes that can be called the ovarian flutter, or the final sort of spurt of the ovaries to reproduce one last time. So the follicle stimulating hormone and the luteinizing hormone can cause the estrogen to go up and down and up. And so in the beginning of perimenopause, leading up to menopause, you might notice that your periods are actually heavier or closer together, which
Can they be irregular,
they
like
can be
sometimes every 2 weeks or
irregular
something?
for sure. So as you're trying to optimize that phase, you're not going to throw hormones at it right away. You're really going to focus on liver health. We were talking a little bit before this talk about how important the liver is. So making sure you're getting enough water, making sure that you're getting enough fiber, making sure that you're maybe getting some plant phytoestrogens like flaxseed to make sure that you're clearing that recirculating estrogen out of the system and into
What
the bowel
about
movement.
hemp
Hemp
seeds?
seeds, chia seeds. I'm a big fan of seeds. If you ask any of my patients, I am drilling down on 2 tablespoons of seeds twice a day because it'll fix
Twice.
almost anything. You got to make sure you're
Whoa.
pooping. You cannot be constipated. If you're
Yeah.
constipated, you're just backing up with all of your toxins, and your liver, that's your filter for your whole body. You got to minimize your alcohol. Alcohol can really exacerbate menopausal symptoms.
What about
So
coffee?
coffee actually can be really helpful in moderation. And I may be the wrong person to ask because I love coffee,
Me
but
too.
coffee helps stimulate, the liver and gallbladder to eliminate.
So
If you're drinking so much that it's making you anxious, then it's not helpful. But, coffee in a lot of studies is protective against Alzheimer's and
yeah,
dementia. So I would say 2 to 3 cups of coffee a day before about 2 p.m. is great. After then, you might notice poor sleep. But I think what's important to emphasize is it's going to be different in every person who's
you have to
experiencing
test it.
perimenopause. So you have to listen to your body. And I think that's the first thing is mostly these women are so focused on their kids or their job or their parents or their community. They aren't focusing on themselves. And you have to really pay attention. Does this fourth cup of coffee serve me? Or is it
Yeah.
robbing Peter to pay Paul and I'm going to pay for it later?
Yeah, so the estrogen to optimize that as it can go up and down, um, the seeds are really good, hemp, flax, and
Yeah,
chia
flax
seeds.
in particular, because it's really
Oh,
high in lignans, which are really helpful for the liver, and it does have a little bit of a phytoestrogenic property. So menopause in sort of a dark way is a little bit like a drug addict seeking their fix because your hormones are declining and the receptors are craving estrogen. So you get some of the same symptoms like the hot flashes and the night sweats and the irritability and the blood sugar and insulin resistance. And so if you can put some plants in there, which, if we talk about bioidentical hormones, that's mostly coming from wild yam, which is a
yeah.
plant structure that is similar to our estrogen to gently bind those estrogen receptors. It sort of calms them down and makes them a little bit more chill. So that's why flaxseed is great. I do bliss balls with flax and dates or flaxseed muffins or flax on yogurt, however you want to get it
Some
in.
flax, raw flaxseed.
And for runners, chia seed comes from Central
Oh,
America.
it gives you so much energy.
And I forget the name of the tribe that was featured in Born to Run, but they
Yeah.
they ate a lot of chia seeds. And actually, I have a cookbook from Oaxaca where we make a limeade with chia seeds in it. So it's easy to
Oh,
digest.
I
It's
need
full
that.
of omega-3s and fiber and protein. So it's a great tool for
Oh,
runners to
yeah.
have chia seed snacks, and it's good for just about everything. So I'm a cheat evangelist.
Well, I remember there was some drink. I forgot what it was. It was a drink. Um, it was a chia seed drink,
It's a
and
mama chia.
I don't remember, but I
It's like
drank it and I
vinegar
felt
and
like I
chia
was
seeds.
on drugs. Like this is performance enhancing.
It's
It
good
was a
stuff.
lot of energy.
Yeah.
So, okay, so to get the balance of estrogen, these seeds, especially flaxseed is good. Is there a problem with men taking flaxseed estrogen? You said phytoestrogen? No.
No.
Okay. I didn't think so, but I wanted to check.
Mhm.
And I like hemp seeds.
I like hemp seeds too. They're great. I take all seeds. If you look in my fridge, because I always keep them in the fridge to keep them fresh, I've got hemp seeds, chia seeds, pumpkin seeds, and flax seeds pretty much on a regular basis. And I just think
Okay, I'm on it.
variety is good for your microbiome. Variety is the spice of life. So if you
So
want to get into the weeds on cycling women, you can do something called seed cycling, where you use different pairs of seeds at different times in the cycle. But most people that's
just
too
get some
complicated.
seeds
Just
in.
get your seeds in every day.
Like just get raw chia seeds, flax seeds, and hemp seeds.
Mm-hmm.
Okay, keep them in the
Keep
fridge.
them in the
Mine aren't in
fridge.
the fridge. Gotta keep them in the fridge.
Well, in Bellingham, most of the year, that's not a problem. But if you're in a more humid environment, they can go rancid. So,
Boy, that's a good one. And so ideally, if somebody's adrenals are doing well, and we talked earlier off screen, the structure, like the body has the right space here and everything moves really well, which I want to talk to you about that. But if things are optimized, what should estrogen do as somebody's getting closer to the menopause moment?
yeah, estrogen should be declining rather steadily,
Just like this as opposed to like this kind of thing, or
ideally. But, I think that's kind of impossible to say because in an ideal environment, that's never really going to exist. So we do
so
the
it can
best we
still go up
can.
and down.
And you mostly have to go by symptoms. So even if your estrogen is going up and down, you should still be able to get through the workday. You should be able to maintain your relationships. You should be able to do some type of exercise that you enjoy. If it's debilitating and you're having mental breakdowns every day,
Is that
we
what
got to
estrogen
address
does?
that.
Like if tell us the symptoms when estrogen goes up and when it goes down during this cycle.
I mean, so estrogen, first of all, I want to say it's not the villain in every story. I think estrogen's been villainized in a lot of ways. Estrogen's great. Estrogen makes your
Yeah.
bones strong. It's good for your heart. It's good for your brain. So when your estrogen is nice and high, which if we go back to a cycling woman, maybe my age, 35, mid-cycle ovulation, you're feeling good. You've got your mojo up. It's similar to testosterone in a lot of ways. It's your motivation, your get up and go, your sex drive, your libido, your strength. it's really important. When it goes down and declines, it's sort of the opposite of all of that. It's like the week
Oh,
before your period. So you're emotional, you're retaining water, you have poor blood sugar management. So with training, that can be really difficult because you have to eat more protein and more fiber more consistently and not just run on carbohydrates like you can get away with in the rest of the cycle. So that up and down, it's not always a bad thing, but it is something to be aware of.
so if it's going up and down, you might feel really good and kind of like when you're
Like
having
the rug gets pulled out from under you. Yeah.
Oh,
It's like if you're feeling really good and then you go out and have 3 margaritas and stay out too late, which I don't know who's going to be
then you're
doing
going to
that in
be
this day and
like,
age. The
yeah,
next day you're going to be paying for it. Yeah.
okay,
Your tolerance for everything is a little bit less.
or a lot less.
Or a lot less. Or a lot less. Yeah.
Okay, or we all have our things.
Yeah.
Okay, so okay, that's good information. And now what tell us about testosterone in women. Like the ovaries make some testosterone, right?
Mhm.
What tell me about testosterone and what happens around perimenopause and menopause.
Yeah, so testosterone actually can be created from DHEA, which comes from the adrenal glands, and then converted into estrogen. So for some women, if your liver is sort of blocked up in the estrogen detox or conversion areas, you can sort of have backup and have androgenic properties where you can see androgenic hair loss. And androgenic just means like male pattern baldness, hair loss. You can have weird facial growths. Everyone has a few chin hairs, but it can really
Yeah.
get out of hand if you're not watching it.
So that's a liver that's backed up and can't
Mm,
deal with its stuff. Okay.
And there are certain herbs and certain nutrients and certain supplements that we can use to shift that sort of conversion rate one way or another. But testosterone, I don't use that probably as much in my practice as the other bioidenticals like progesterone or estrogen. But for some women, if they're having a really hard time maintaining muscle mass, that can be a big one. If they're fatigued, and we've ruled out anemia, we've ruled out viruses, and it's just really low testosterone related fatigue. And maybe they overtrained for a long time and they're having a hard time bouncing back, a topical testosterone can be really helpful at the appropriate dose. Mhm.
Okay. So and then so you got the different seeds, you've got the adrenals and the liver is really key. What not just athletes, but people around here are very active and want to be active. What can you do? What's your approach to improving the way the liver can do what it needs to do to make things work with this cycle that needs to happen with the hormones
Mhm.
and the adrenals? Like what are the what to do?
Yeah,
Like
I would
you've
say
got the seeds. The seeds
liver
are
and adrenal health is probably the number one thing that I focus on with people in general. Um, it all goes back to the nervous system usually. So it's how do we manage, because we all have a lot of stress inputs. We have a lot of demands, the world is falling apart on top of that. If you're a sensitive person, that can be really difficult. So it's learning how to manage your stress response. I recommend working with a therapist and doing EMDR if that's helpful. I use a lot of nervines, which are herbs that work on the nervous system. That's usually in the mint family. So any type of, which chia seed is in the mint family, interestingly enough, which is kind of fascinating.
So chia
So
and
mint, lemon balm, lavender, catnip, skullcap, those can all be really helpful at calming the nervous system on a daily basis. I like to put them in teas because it gets more people drinking water, which is always helpful. I'm a big fan of something called stress factors, which is not a recommendation, but it does have some GABA, which is a dampening neurotransmitter. It has a little bit of lithium, which is a mood stabilizer. So just kind of to take the edge off and get you through the day without being so sedated or on a medication where you have a lot of side effects. I would say for athletes and almost anyone in my practice who's stressing, exercising, or has hormones, I'm putting them on magnesium glycinate. So magnesium really helps the muscles repair, it helps improve blood flow, helps relax the bowels, it helps hormones, detox through the liver, and then the glycine helps calm the nervous system. So magnesium
glycine.
glycinate,
So
it's
more
kind of, I hate to be generalist, but that's what almost everyone is on, cradle to grave.
and so you got magnesium citrate and there's that one that's like seems synthetic threonate or something.
Threonate, that's great
And
for the nervous system. Oxide and citrate tend to stay in the bowel, so they're more of an osmotic laxative. So it's great if you're constipated, but you're not absorbing that into your cells very well. Magnesium glycinate's usually my favorite because it comes in a chelated form, so you're actually getting it across the cell membrane.
oh,
And then the glycine helps calm the nervous system, so that's really helpful. And then for you and I, the majority of our practice is fascial counterstrain or integrative, manual techniques. And working with the fascia around the liver and around the nervous system and around the adrenals to physically improve blood flow to those areas and heal old injuries and scars can be, absolutely critical and really, really helpful. And what's nice is you don't even have to speak the same language as someone. You can help their body learn to relax rather than maybe doing something like talk therapy, which can be great, but sometimes it's triggering if they don't want to just talk about the stressors that they have in their life or have had in their past.
And if you have a liver that's got some structural problems, some tightnesses, some things aren't working, and it's backed up, like you said, the margarita effect, you could, like, I can't even imagine trying to have talk therapy to get somebody okay with having a hangover. It's like it'd be nice to fix up the chemical balances and get the structure optimized first. Well, this is really good. And so you and I do have that, you have the fascial strain counter strain. We have the integrated manual therapy, which has a strain counter strain component to it. And I like the way my teacher, Tom Gimateo, talks about you could have a factory that's 100 square feet and it's making 1,000 widgets is his example. And that could be like the liver, making 1,000 things happen here. But if all of a sudden it's not 100 square feet, it's 50 square feet, it can't make as many of the widgets. And so with the liver that is structurally bound down, or the area right in here with the adrenals is structurally not moving very well, you do have that fascial strain counter strain. Tell us about the structural approach to like getting, you've got yoga, qigong, we got all sorts of things to
acupuncture can be great too, for sure.
So yeah, anything you want to say
when I'm
about
approaching someone, so
the fascial strain counter strain idea. I had a thought come to me today about strain counter strain. I'll tell you anyway. It came to me. I thought to live in the interbarrier zone, like with strain counter strain, we talk about a position of ease instead of trying to stretch something. I thought, oh, that's kind of the sweet spot of life, like to be right there where you have all options open to you, and you don't have to like be trying to force something. Tell us about your structural approach.
I think in general, the way I approach the body, and I think it's similar to you, is that the body is inherently full of wisdom. And so if we're constantly trying to fight it, pop it back into place, overstretch, over manipulate, we're not exactly creating an environment of safety. And if our body doesn't feel safe, if our brain doesn't feel safe, we can't heal. I mean, that's just how it is, plain and simple. Our body is not trying to do us harm. And when we're working with the fascia, I think what's really fascinating and why you and I both probably like this work so much is we're working with the type 3 and 4 deep proprioceptive neurons in the fascia. So you're literally working with the nervous system when you do fascial work. I can work on someone's toe and I'm still causing changes in the brain. It can be very, very powerful. And what not a lot of people realize is that even, before you have an injury, it's really essential that you have a healthy fascial network, or you can be prone to injury, or you can be prone to disease. And life's cumulative. So you don't always know what's caused what, but you could be in a car accident and the seatbelt, injures your liver. 20 years later, you're having a hard time maybe clearing alcohol or clearing drugs from your liver. So before we add more drugs, and I don't mean necessarily recreational drugs, but hormones are drugs. We want to make sure that that liver is really optimized. So I treat the nervous system probably more than just about anything else, because the world is stressful and our lives are stressful, but also because it helps everything downstream. If you just keep treating the same sprained ankle over and over and over again, and you don't address the balance between sympathetic and parasympathetic nervous system, are you in that healing state long enough to actually recover from that injury? Probably not. It's good job security because you can do the same thing every week for 12 weeks, but that's not going to get that person better. So one thing that I also like to have people do, which I just thought of, is track their heart rate variability. Everyone's got a Garmin these days in this town, and the heart rate variability is a great, cheap, and easy way to monitor your vagal nerve health and your parasympathetic nerve health. And if you've got heart rate variability down into the single digits, you got a problem. So you need to go see someone, or do your breath work, or do your meditation like it's your job to get that heart rate variability up, or you're not going to be able to heal.
We talk about it in the idea is an athlete overtraining, checking that and checking the resting heart rate in the morning, and one that we like a lot is from the Norwegian method. They have a really neat idea. Just if you have a set of stairs that you always climb every day, or you can do wall squat kind of like things, but you just get the, how are your legs doing? How's the muscles? Like if you're exhausted going up the stairs one day, but other days you're feeling really good, it's another sign. But those kind of things that
That's what we
HIV
need to learn how to listen to, because it's going to change for all of us. It's going to change as we age, and it doesn't have to be a bad thing, but you just, if you want to have an optimal, healthy, long life, you have to be able to listen to your body and make changes.
Yeah. What would you say? I agree so much. What would you say to women, especially that are busy with lots of demands, and this time of life can be a big, like, questioning what to do next in life, as the kids get older and that sort of thing. And there doesn't seem to be a lot of time for even just doing a little yoga or something.
Right.
Okay, they
You
could
put
come
yourself
see.
last.
I know. I want to kind of reach out and just say, if it speaks to somebody, I mean, I would recommend seeing Rachel and me and
Yeah.
getting the structure of this fixed up, and then see Rachel for the labs and stuff, and get a plan, because so many tell us a little bit about the idea, like you want to be looking in the right place, like if it's a structural problem, let's get the structure fixed up. If it's a problem with we don't have enough of the seeds and that sort of thing and the nutrients, and let's get that fixed up. If it is a talk therapy problem, maybe there is something to do in that world, but finding the taking the time for yourself, and then and finding a way to see what's the plan direction for this particular person, because it's easy to just be doing a lot of stuff that's, how do you know which way to go?
Mhm.
And also the idea, like, what would you say to somebody that's like, they're just not taking the time to go look to fix this? It's like,
Mhm. Well, I would say, first of all, in the age we live in, I think there's information overload, and so people just shut down. So the first thing I would say is don't listen to every single social media professional or expert on hormones and menopause, or you'll end up doing intermittent fasting on top of HRT, on top of cold plunges, and it's just way too much, and no one has the time. So it's like if you overcommit, you're not going to get anything done. So I would say work with a professional, first of all. Work with someone who can walk you through the high yield points that are going to make a big difference. When it comes to women not prioritizing themselves, I mean, that's an issue as old as time, to be quite honest. But I sort of liken it to being a practitioner like you and I. There's something called physician heal thyself, which is that if I don't take care of myself, if I don't drink water and I don't get sleep and I don't schedule my appointments with someone like you, then I'm not going to show up and do a good job. And so I think you have to view it that way. Women are responsible for taking care and nurturing so much of our society. If they don't take a few times a week for themselves to take care of themselves, they're not going to be able to do a good job. And we need women to do a good job because they do so much for us. So usually it comes down to scheduling. And that's sitting down with your calendar and carving out an hour to go, get an appointment done, or an hour to go get your labs drawn, or an hour to have a walk and a tea with a girlfriend. You just have to plan it. And most women are pretty good at planning. So if you get it in your calendar, you have no reason not to get it done.
I hope this is reaching people, because it's like, if you can see you, see me, if that sort of, whatever resonates with you, whoever can truly find what's going on with you, then you can get your plan, and then it doesn't have to be a big time intensive thing. You just know what to do for you.
It's just another thing on your to-do list.
Yeah.
I go take care of myself. I go change. It's like changing the oil in your car. You have to do it. There's no reason
Yeah.
not to if it's already on your schedule.
Yeah, you don't get to go get another car on your lease if it's
Right.
body.
You got one body.
You got
Yeah.
one body. Well, thank you. This has been really good.
Yeah.
I'm gonna make some notes about this and put it in the description. The key things, like the magnesium glycinate and the seeds, and this idea of structure and the liver and the adrenals, and knowing when you're over the edge, like the HRV or morning heart rate, or the step test, or like and then just hopefully taking the time to take care of yourself, find a plan that can get you to the next level, because it seems like there's a lot of
women suffering out
there
there.
is, yeah.
And I think not all practitioners are trained on what questions to ask. So you got to talk to your girlfriends, talk to your mom, spread the word, and really, identify with practitioners who are going to listen to you.
Yeah.
There's kind of a morbid statistic in emergency medicine that I heard recently that if a woman enters a emergency room with heart attack symptoms, she's 2 or 3 more times likely to die if she's seen by a male practitioner who doesn't know how to ask about the differences in women's physiology and anatomy when that's presenting. So you really have to advocate for yourself, and that starts by listening to yourself and then working with practitioners who will take the time to listen.
Yeah, and then you have your scan. I don't know exactly what you call your fascial strain counter strain scan, and we have our myofascial mapping.
Mhm.
There's a way to with your assessment to find what's the root causes for this particular person. Like this
Sort of
particular
that
person might need
hierarchy.
more seeds. This person might need a lot of structural work. This person might need some meditation work. There's a way to not have to just guess and go to the latest Instagram post. So that's one of the things that
I
you
think
have.
that might be something that you're more specialized in than me. I can scan the body and know whether it's an adrenal versus a spleen, but I think that might be a special skill that you have more than
Well,
me. Yeah.
thank you.
I have intuition, but I
Okay,
can't
well,
scan that.
we have a, I would like to see us work together with people because I don't have the labs. I don't know the doctor type stuff, but that's why I like having you here and telling me stuff. It's partly for me just to know more stuff.
Okay.
So thank you so much. And I'm gonna get your thing. It's I was forget exactly how to say the name of your company.
Veratrum
Veratrum.
from natural medicine. It's false hellebore, which is actually a very toxic plant, but that's why you got to respect it.
Veratrum natural. Here we are.
Yeah.
Let's see. So the phone number, it's here in Bellingham, right here in Fairhaven, beautiful Fairhaven, 1514 12th Street, Suite 101. The number is 360-230-8170. So Veratrum, Veratrum. I'll put the links below. And then I'm Ralph Haven's physical therapy, Beyond Limits Physical Therapy here in Fairhaven at ralphhavens.com. And so reach out to us and let us know what you guys think. I want to ask you more stuff and I hope a lot of people find you and
Yeah, well, thanks for asking, and thanks for bringing menopause, to the forefront, because it's affecting half the population. So we got to talk about it.
I know, and there is an answer for this.
Not everyone has to suffer.
Yeah. I'm gonna make some notes and put this for everybody. So thank you everybody, and we will see you all real soon.
Great.
Okay, thank you so much.